to that infrastructure discussion. See, an MDMS from an average institute of the tier 2 or tier 3 cities infrastructure, comparing with a corporate hospital in a tier 1 city, especially in the field like surgery. I think Dr. Wasim sir, can you clarify a little about that? Because of that, you will be performing the high-end latest surgery and protocols.
Yeah, Dr. Sridhar, I would like to add a point here actually. I would like to supplement the point which was discussed previously first. MDMS versus DNB. See, if you are clear about what you have to do now, when you take a specialty, if you are going to stay back as a specialist, then it doesn't matter whether you take an MDMS or a DNB. But if you want to do some super specialization, then also there is no differentiation. Because I am telling you, MDMS and DNB are equally eligible for NEET super specialty examination. If you want to become a super specialist, there is no discrimination between whether you are an MDMS or a DNB. As already told by Dr. Naveen sir, it's very important how fast you are going to enter into the stream of specialty. Okay, that thing is very important. Now coming to the present question. See, MD, MS versus DNB regarding general surgery, I will be having a word with you. So the point now is the surgical advances now have shifted from open surgeries to minimal access surgery. So the minimal access surgery will have a lot of things like laparoscopic surgeries, endosurgeries, robotic surgeries and all. Okay, so now previously the medical colleges were not having all those laparoscopic instruments, high-end instruments with them. Now the trend is changing. Even a few government hospitals are getting laparoscopy instruments, but not adequately. See, there are people are more, instruments are less. And even if you come to the private medical colleges, maybe the instruments are more or instruments are less. It depends on the infrastructure of different medical colleges. In the corporate hospitals, you will be having technology updated. You will be having regular updation of the instruments. You will be getting newer advances in the laparoscopy. You will be getting newer advances in the laser surgery and all. So, if you are going to choose something specifically like this, we have all the data. Like we know, like see this perfect medical college, is it having laparoscopy or not? Whether there are advances, recent advances going there or not? Whether everything is as per the recent protocols or not? You should know that DNB hospitals are also DNB teaching institutes. There will be continuous updation of the knowledge. It is not something like you join the hospital and there will be no teaching. There will be teaching curriculum, you will be having updation. And as far as I go, you have to personally go into the choice and then look into it. And as far as I know, the corporate hospitals keep on updating their technology. And that's it.
Nice. Thank you, sir. Now what we will discuss is we'll like to call upon Dr. Pallavi Madam, who is a consultant pediatrician who completed his DNB and right now she is a registrar for a corporate hospital. From her point of view, the comparison with their colleagues or the current practice, is there any difference now in the practicality?
Thank you, Sridhar. Am I audible?
Exactly, clear now.
Yeah. This is a very important question what you asked. That is the thing will be there in the NEET PG aspirants because they'll be thinking like once we complete the course, like whether we will be equivalent or on par with the people who does the MD. So I would like to clarify everyone. You will be equal, and actually if you have done your DNB from a corporate hospital which is having all the high-end instruments, you will be more than them. So because as we are seeing here, we are getting the referral cases. So you'll be getting, it is like a tertiary setup. So you'll be having the all high-end instruments and you'll be learning the recent things. So actually you'll be better than them if you ask me. So in a corporate setup, if you are doing a DNB, so what is the main thing is like as Dr. Wasim said and Dr. Rishwant and Dr. Naveen were telling, the subject what you like is important. So don't compromise with the branch. So whether it is DNB or MS, because DNB is equivalent and the academics is structured. It is also a teaching institute. So you can go ahead with the DNB.
Yeah, thank you so much. Actually, you have cleared it up. Now we have seen whether actually users or the people viewers who have joined our session, it's not mean to promote DNB or de-promote MDMS. It is a way to see the things in different angles. Now coming to the rank wise, I would call the counseling expert, Mr. Kumar Madhav, to talk a little bit about the ranking, how the MDMS goes and the DNB goes. Because when the people got subtly satisfied with their branch, they will want to go either one of the way. So in that way, how come the ranking differs? How far it is possible, at least for the major subjects?
See, myself, Madhav. So, I'll start from the top demanded subjects. So definitely, according to Dr. Sridhar, there is a rank difference between different subjects. So lots of candidates are there. Even I used to get hundreds of calls per day asking about DNB is better or MBBS is better. So choosing subjects, main thing is whatever subjects you are going, that subjects will be for you, with you for long time, for your lifetime and all. So first go with subject. And there are difference, no doubt there are difference between MDMS closing rank and DNB closing rank. But if you see from past 2 years closing rank, now there are lots of candidates are there, they are choosing DNB over MDMS because of the bond thing and all. There are few states where candidates they don't want to join because of the high bond and all. So states like Assam, West Bengal and all, candidates they are not preferring. Those states they are closing after this DNB seats. So it depends upon seats and this thing the place. So candidate there are candidates they are preferring good DNB institute over MD or MS government medical colleges. So even this year lots of candidates they are going to do same thing. They are preferring, especially they are going for the metro cities like Delhi, Mumbai, Bangalore kind of places. Those are in high demand. So there are rank difference. If you see MDMS, then it depends. There are some rank difference between these two subjects.
Okay, thank you, Madhavji. In general, now we have concluded. I think everyone in the panel will agree with me. Branch should be the foremost factor in deciding the course, right? So moving once the branch is fixed, the people who are in the top rankers, aram say they can get in the MDMS branch, and which is not disputed much because the ranking is already given in the state wise, so they can easily choose. When the people fall in the grey zone between the top rank and the average rank, they will be land up or opportunity will be more for them for DNB. And there are lot of colleges in the country of DNB Institute. So how to go about this? And also so much confusion around DNB because of multiple institutes, multiple states, and even stipend basis. So can you explain a little bit about that, Dr. Wasim?
Yeah, sure. That's a good question. Regarding stipends, okay. The National Board of Examination has passed a circular. Okay, it says because NB runs DNB courses all over India, it means the NB is a governing body which runs the whole course all over the India in multiple states. So as you know, in every state there is a state university and where MDMS is also being conducted. So what NB has given a circular is the base stipend of a DNB resident should be 35,000 for first year, 37,000 for second year, and 39,000 for third year. Okay, that is the base stipend. But if in case the MDMS resident of your state where you are doing DNB is receiving more than this stipend, then you will get the stipend which is prescribed by the concerned state government. Am I clear? If in case your state government is giving something stipend less than this 35, 37, 39, then this 35, 37, 39 will be the standard stipend for you in your DNB course. Okay? And regarding the fees also, regarding the fees details of DNB, it is 1,25,000 now. Previously it was 1,25,000 plus 18% of GST. Recently, Association of DNB Doctors have written a case in the court, and we have almost there is an interim judgment where we are halfway through, where they have put a stay that NBE should not collect GST from the students regarding the fees. So almost the 18% of GST is out of the picture. So now the DNB courses course fee per year stands at 1,25,000. So over to you.
So there are few instances or facts saying that some of the DNB institutes offer course free of cost. refund is possible for the course fees. So Dr. Syed, can you a little bit explain that?
Yeah, thank you, Dr. Sridhar. Actually, what I would just like to add, everything has been clearly explained by Dr. Wasim sir. The main thing what we have to specify is there are certain hospitals in DNB where the whole fees is totally refunded, and the stipend is also given as per the details of what NB is prescribed, like what Wasim sir has told, all or the state, whichever is higher. So in some institutes, for example, like Satya Sai Institute, what happens is the whole DNB fees which you pay will be refunded. Now, even in that, the total fees, if we say as of now is 1,25,000, in that 1,25,000, 20,000 will be your accommodation. Everything 1,25,000 will be refunded to the student in some institutes. And regarding the stipend also, there are some institutions will provide stipend as per their institute choices. Like for example, the Rainbow Hospital in Bangalore, which will provide a better stipend than that of a state stipend. So because for knowing all these details, I think Kumar Madhav will be a perfect person to explain you everything.
Yeah. So like before going to Kumar Madhav, I will get an answer from Dr. Richard because he is in the field right now as being a resident in a corporate setup. Have you heard of any news, Dr. Richard? Like, is there an irregularity in the stipend payment? If not in your side of the neighboring college or state, can you explain a little bit about that?
Yeah, definitely the stipend is a very big problem in DNB because once if it is a government institute, definitely we can go for whatever things we want. But once we are joined in a private hospitals or private corporate mission hospitals or any smaller hospital, definitely stipend is a bigger problem. So what is the thing we have to do regarding this is we have to call directly the resident from there, and we should know about the details of the stipend. But it is not possible to call all over India, all the institute. So that's why we are here. The NEET Predictor team is here. The Kumar Madhav ji is there. So we have we have collected almost all the hospitals all over the India details to help the NEET PG aspirants, which will be very useful for them. Because stipend during the PG preparation is during PG preparation we won't get any we won't go to any hospitals. But once we join the post graduation, definitely we should get an adequate stipend to support our family, to support our study, and further future studies also it is definitely needed. So Kumar Madhav is a perfect person for to know all the details, and he will definitely help all the PG aspirants.
Yeah. Nice, Dr. Rishan. A little bit before going to Mr. Kumar Madhav related to the stipend ranking of the entire state, I would want to get the answer from Dr. Navin Gowda, who has completed DNB super specialty.
I would like to add one more point here.
And Sir's opinion about the stipend regularity or irregularity, whatever in your experience, since you are the senior most. Yeah, sir, please.
Yeah.
So I think you can't hear you, sir.
Like if we complain to the hospital will lose the accreditation for the next year. So the stipend which is given is very regular.
Yeah, I think sir is having some technical glitch. If Dr. Wasim sir could complete, it will be better.
I think Naveen sir is having some technical issue on his end. You see, the point is what sir was trying to tell is National Board of Examinations had made it clear that the institutions which are getting accreditation from National Board have to function as per the rules and regulations laid by National Board of Examination on a regular basis. If you deviate from this, even your accreditation for the National Board DNB courses will get cancelled. NB has made it particular that the students, whoever are doing the DNB course in the NB accredited hospital, should receive stipend. If a hospital is not giving stipend, then that hospital will be removed from the list of DNB institutes and its accreditation will be cancelled. I think that was what Naveen sir was trying to do.
Thank you, sir. Now you made the point very clear. Now I would like to call upon Mr. Kumar Madhav ji to explain the ranking of stipend state-wise.
Yeah,
that will be very informative for all the viewers right now.
While choosing this DNB institute based on the stipend and all, I'll always prefer the railway hospital
Railway
Those
hospital.
railways hospitals, like they usually pay according to the government pay scale. So if you see the railway hospital Delhi, then they are paying around 1.1 lakhs stipend. If you see the Baba Saheb Ambedkar Railway Hospital over Maharashtra and all, they are also paying around 95,000 to 1 lakh stipend. And if you see the state-wise stipend details, then Delhi is the topmost, like demanding state, and they are paying like around 80,000 to 1 lakh, 1.1 lakh up to stipend. Then after Delhi, if you see Haryana and all, even they are paying 75 to 80,000 stipend per year. Maharashtra is a very high demanded state, and candidate all over India, they're asking, like these days, like they're asking for Maharashtra and Delhi Institute. So
Yeah, but still talking about Maharashtra here to intervene, there is a factor called accommodation. If the hospital or the institute which provides accommodation, will there be a variation in the stipend, or it is just on par equal? Can you explain a little bit about that?
It depends, because according to NB, like 1,25,000, like the doctor, he mentioned the 1,25,000, out of which 20,000 is the accommodation fees. So there are like lots of hospitals. Like I started with railway hospital, ESIC and all. They usually provide the accommodation. So if you'll go for some like big cities, then it will be very much difficult for you if they are not paying you this thing. If they are not giving you accommodation and all. So basically, like maximum institute, they usually provide accommodation. Or else, like if you are not getting accommodation over like some metro cities, then the stipend, whatever you are getting, it will be very difficult to save some amount from there. Even like cities like Mumbai, Bangalore, or else like Delhi kind of places.
Nice, thank you.